Oh boy, depression's tough. A lot of people suffer from depression. When you look around the world, what you find is that you're more developed, wealthier countries, you have higher rates of depression, higher rates of suicide. So it may be tied to what we believe, and maybe, of course, tied to many other things that go on in these various societies. But there are some things that you can do that are very powerful to deal with depression. First, I'd like to take you to the work of Richard and Judith Wortman at MIT. And they published their studies in the 1980s. And what they showed is that when you eat animal foods, which contain a lot of heavy neutral amino acids, you prevent tryptophan from getting into your nervous system. Tryptophan is an amino acid which turns into serotonin, which relieves depression. In fact, there used to be bottles of pills of tryptophan sold to the public until they became too competitive for the pharmaceutical-made antidepressants, and they were taken off the market. So when you eat a diet full of animal foods, these heavy neutral amino acids, what happens is there are gates between the blood and the brain fluids, the spinal fluids. And these gates get occupied with heavy neutral amino acids from animal foods. And because they're occupied, the tryptophan can't get into the nervous system. So you have a depleted amount of serotonin production. So Judith and Richard Wortman, go back and look at their work, and you'll find that they treated cyclic menstrual problems that women have with a high carbohydrate diet, sleep disorders, depression, etc. Very powerful tool. But there are some other things you can do with depression. And some of these you're very familiar with, and so I'll just go over them quickly. One is exercise. You've probably heard of the runner's high with the production of endorphins when you exercise. And so there's a great tool to exercise. You don't want to hurt yourself when you exercise. You want to find the right exercise you enjoy. You've probably heard that sunlight has something to do with your mood. I worked in Minnesota in the Twin Cities for a period of time. My job was to take care of the employees of Blue Cross Blue Shield. Tremendous results, by the way. We cut their healthcare costs by 44%, 3 years in a row, by simply changing the diet. And, I had to take care of the people. I was a licensed physician in Minnesota. And I took care of the patients, and I would get this typical history. In fact, more than I'd seen before. Maybe 20, 30% of the women I saw were depressed and on antidepressants. Well, the excuse was, and it was true back then, that they had a lot of cloud cover back 20, 30 years ago. Of course, it's very sunny in that part of the world now. But a lot of cloud cover, and as a result, you got seasonal affective disorder. And you may have heard about this. You treat it with lights that simulate sunshine. You set them up on your desk and these light boxes. And that's one way to do it, or just make sure you get enough sunshine during the day. Now the last thing that I want to tell you about depression is the most powerful tool there is. And it has to do with controlling sleep. Sleep produces a depressogenic substance. It causes you to be depressed. Now, you may have noticed this, like you may have noticed on the weekends when you get an extra hour of sleep. Kind of the whole weekend goes blue, doesn't it? Or you may remember when you had a big project to do. Say you were in college and you were studying for final exams and you stayed up all night for 2 or 3 nights. What happened to people? You and your friends got manic. You were bouncing off the walls due to lack of sleep, and you can get mania easily from lack of sleep. So you want to balance it. You want to get enough sleep so that you relieve fatigue, not so much sleep that you become depressed. The study started in the 1970s, and they're published, where they took people with severe depression problems, in fact, so bad that they were classified as suicidal. And they kept them up one night, and 70% of the people were relieved of all their depression within a day. Now, of course, when they fell back to sleep, they got depressed again. But one night sleep depression caused them, suicidal people, to get complete relief of the depression. just by not sleeping a night. There are actually clubs around the world where people get together and they help each other stay up a couple of weeks a night or a couple of nights a week, as a treatment for their depression. At UCLA, they actually have trying to find out what this depressogenic substance is. And as far as I know, it's not been discovered yet. Even as much as a nap will cause people to go back into depression. Well, the idea of staying up one night, all night long, does not sound very pleasant to me. And so there's something called partial sleep deprivation, which is what I prescribe for patients. And that is they get less sleep. How much sleep? Well, enough to relieve fatigue, but not so much so that their mood is depressed. And how much sleep does an adult need? Well, I would base that on longevity. The longest lived people get 6 to 7 hours of sleep a night. More than 7 shortens lifespan. Less than 7, what happens is a shortened lifespan. What you need to do is you need to figure out that you're an adult, you're a healthy adult, and you would get best on 6, 7 hours a night. But that may be too much for you. Maybe you need 5, or maybe you need 7.5. But you certainly don't need 10, 11, 12 hours of sleep a night. Sick people need that much sleep. Little babies may need 16, 18 hours sleep a night. Pregnant women, but not healthy adults. So here, let's put it all together for you. All the simple, safe, effective ways to deal with depression. You know that you're supposed to eat carbohydrate and stay away from the high neutral amino acids that come from the animal foods. So you start out in the morning with a bowl of oatmeal. The sun's just coming up, so you want to get lots of that sunshine. You put on your walking shoes and you go out for a good walk, maybe even before your oatmeal's done. You got the sunshine, you got the endorphins with the exercise, you came home and you ate a high carbohydrate meal, and you're just off for a really good day. And the end of the day comes and you decide that you've got to take care of this sleep issue. And it may be better to go to sleep earlier and wake up earlier than the other way around. But you say, look, I got to set my alarm clock. No, I need 5 hours of sleep a night. I need 6. If I know I don't feel well when I get 8, 9, 10 hours of sleep a night, set that alarm clock. Get up that next morning, have yourself a high carbohydrate breakfast, put on those walking shoes and get out in the sunshine. And then after a few weeks, you're going to really get a big kick as far as your feelings go in terms of your self-appreciation. You're going to take off your clothes and you're going to come home and you can look in the mirror. You go, wow. That's a good looking person. It's amazing how much depression will go away when you come to that realization. Non-toxic, highly effective tools you can do to change your mood, change your life, change the lives of people around you, change the lives of family members. Much better than doing it with drugs, folks, which are highly toxic, addictive, don't solve the problem. You can fix it with the food, a little exercise, a little sunshine. I'm Dr. John McDougall.